For those of you who do not know me in the room, my name is Julie Yonker, and I'm the manager of Home Health, Volunteer Hospice, and Lifeline. And about a week or a half ago, Ken called and said, "Hey Julie, I bet you could present a home health story to the Mission and Values team." And immediately on that phone, I said, "I don't have to wear a dress, do I?" And he said, "No, just be yourself. But if I came in a dress, this is what I would look like." That would be it. I start presentations and meetings with reflections too, so thank you for your wonderful reflection, and I have one too. I am nervous, so. But this is your life. Do what you love and do it often. If you don't like something, change it. If you don't like your job, quit. If you don't have enough time, stop watching TV. If you're looking for the love of your life, stop. They will be waiting for you when you start doing things you love. Stop overanalyzing. Life is simple. All emotions are beautiful. When you eat, appreciate every last bite. Open your mind, arms, and hearts to new things and people, because we are united in our differences. Ask the next person you see what their passion is, and sharing your inspiring dream with them. Travel often. Getting lost will help you find yourself. Some opportunities only come once. Seize them. Life is about the people you meet and the things you create with them. So go out and start creating. Live your dream and wear your passion. Life is short. So always find the good in everything. Every day, take a lesson from the trees, keep growing. And sweetie, I need my water. So it all started with a phone call, and it was about in May of 2012. I might have that date wrong. But it was a gal named Lisa, and she was the coordinator there at the cardiology clinic in Bellingham for Dr. Coletti. And she said, "Julie, Dr. Coletti and I were just curious if you would be able to take care of a home health patient on a milverenone drip." And I said to her, "What's a milverenone drip?" She says, "Oh, that's just an IV medication that's hooked up to the patient that makes the heart pump to get stronger for that heart in order to get an LVAD." And I said, "What's an LVAD?" And she said, "Well, we go into the patient's chest and we put in this piece of equipment and it keeps its heart pumping until he gets stronger for a heart transplant." And I said, "Are you flipping crazy? Do you know that we live in the state of Alaska? On a small little island that's only accessible by plane and boat?" She told me I had only 10 minutes. No technical difficulties practiced. Now when you grow up Catholic, you learn not to swear. But I remember this immediate moment going, oh my gosh, the weight of this patient's livelihood is if I say no, that home health can't take care of this patient, he can't come home. And where would that be? I have faith in my team, lived here for 16 years. I have faith in my community. So I know it's just going to take teamwork. It's going to take collaboration, which is 2 or more people working together to share goals to make this happen. So I need to get educated. So my first phone call was to Great Land Infusion Pharmacy. Now they're way in Anchorage. So to give you some geographical challenges of our island, back on the map, all our meds and drugs and antibiotics, they got to get flown here. They got to get drop shipped. We got to have them in 24 hours for our patients. We have to make sure that they have our meds. So Marilee answers the phone. I've known her for years through home health and says, "I have faith in you, Julie. Your team can do this drip. We do it all the time." The second phone call is to Dr. Collier Brown. Oh my God, she's brand new to our community. I've only worked with her a couple times with referrals, and I'm calling her out of the blue. "Dr. Collier Brown, you ever taken care of a milverenone infused patient?" She said, "No." I said, "Well, neither have I." But working together with Dr. Coletti, am I not right? Am I telling the story right? I just can't believe you're here. I said, with our help, I will help you learn home health. I'll help you on this island, learn how it works, and together we'll take care of this patient. Next person, who's the most important, my manager at that time was Shannon. And I had to, she probably thought I was crazy. No, sure. She has faith in our team. She has faith in our community. So we said yes. So then Dr. Coletti, bless his heart, all I remember is this short gentleman. I'm not going to alter my thing. Short, walking in his jeans, having this meeting at Cape Fox. Dr. Rice, right?
I'm glad I could come.
He was in a flannel shirt, I'm not kidding. All the doctors in the community came to the table. It was 7 a.m. at Cape Fox. Wow. South Tongass Fire Department, North Tongass Fire Department, the centralized fire department all came to our table. The emergency room, Bev, all her team came to the table. The medevac team, Guardian Light, had to come to the table. Dr. Coletti had to educate us that we could do this, that this was going to come to our island, whether we were going to let it now come and get educated, or when the next cruise ship came and we weren't ready. So we took the patient. It's going to probably rip because I've been 7/12/2012. We brought on the patient. And he'd be probably pretty proud that I used ER because that was his personality. But he, all this time, it was now we brought on the patient. And is it really when the rubber meets the road? Are you going to be able to call that friend? Is that friend going to be named Jason, who's the case manager, who's promised to be always on the other end of the line, to be the physician on the other end of the line for our physicians who needed that guidance and training? And yes, because they always had our back. 1 year plus 19 days later, a lot of hills and valleys, and never stopped believing in hope because miracles happened that day. The LVAD was placed at Providence Sacred Medical Center in Spokane. The team was there, the patient was there. Always the quality of life was the goal for this patient. He was a black cod fisherman for years, just ornery, just feisty. He had so many stories to tell, and was he would lovingly, I say this because our relationship was so important to each other. He'd be the first to admit how stubborn he was, but he was there in it for too. He was back in his community living. His family was important. Hunting was a big part of his life. He had grandsons where he wanted to teach to hunt. He just needed more time. But sometimes your goals have to change. Because after receiving the LVAD, all the care but complications happened. And so then our goal to take care of this man in our community where he was able to stay and live with his family was changed to palliative care. The power of palliative care knows, as we all know or don't know, but to be educated affirms life, promotes the quality of life, provides treatment, and supports the family. Pain management is such a big one. Just that emotional connection. He welcomed our hospice volunteer, which is a part of our program, which was really big because that relationship took a little bit to form, but once it did, we provided respite care to him in his home and his family. So what did he teach us? What will I always think of the patient when I reflect on him is he allowed Ketchikan in our community to break new ground. He'll always be the first LVAD patient. He won't be the last. He always told us that goldfish has memories. He taught us that to have no fear, because a life lived in fear is a life half lived. He also taught me that you never know how strong you are until being strong is the only choice you have. And finally, that we're all going to learn from yesterday, we're going to live for today, and we're going to hope for tomorrow. So when that next cruise ship comes, Dr. Clay's on the other end of the phone, right? Because he promised collaboration for everyone. They're going to not feel well. And they're going to need to come off the cruise ship because they need just a few minutes to make sure they're okay before they see our wonderful community. And we're going to be able to take care of them. And for that, I thank the patient. And one final thing for the leaders in the room and the community in the room and everybody in the room, I can't thank you enough for the support for our Ketchikan Home Health, our volunteer hospice, and our Lifeline program. So thank you. And Dr.
And then the most daunting task, which is end-of-life care in a mechanical heart patient. I mean, that brings up extraordinary psychological stress, moral distress. You know, what do you do with somebody who has this pump? And again, I think Dr. Collier-Brown, I mean, not many internists could do this, and they did it beautifully. I mean, I was sort of the distant spiritual director in all this. So I think, you know, I know every email I get from you is there's systemness somewhere. I mean, I think if you want to see an example of collaboration between doctors 1,000 miles apart,
This is it.
this is it.